The main objective of this study, of the EAGLE study, was to characterize the neuropsychiatric safety of varenicline and bupropion versus placebo as well as NRT, both in patients with and patients without a psychiatric illness. The second objective was to look at the efficacy of varenicline and bupropion versus placebo and nicotine patch in these two patient populations as well. The results of the study, and this study was designed with consultation with the FDA. This was a 24-week study, 12 weeks of treatment, 4 treatment groups. It was varenicline, bupropion, nicotine patch, and placebo, as I mentioned, in patients with and without a psychiatric illness. There were over 8,000 subjects in this study, 2,000 in each of the treatment groups, and half of those patients had a psychiatric disorder and half did not. And the results of the study showed that for the primary objective, that is to characterize the neuropsychiatric safety of varenicline and bupropion, showed that there was no statistically significant increase in neuropsychiatric adverse events in varenicline or bupropion versus placebo. Also, in efficacy, varenicline was shown to be superior to placebo as well as to nicotine patch and bupropion. All 3 active agents, that is bupropion, varenicline, and nicotine patch, showed efficacy in both patients with and without a psychiatric disorder, but varenicline showed superiority versus bupropion and nicotine patch. The objective of the study, and again, this was a study that was requested by the FDA, was in response to post-marketing reports of serious neuropsychiatric events that had been made and are currently included in the label for Chantix. But the issue was, were these events related to Chantix or were they related to other confounders such as withdrawal symptoms, underlying medical conditions, or social environment? So in order to answer the question, are the neuropsychiatric events that have been reported, are they related to the drug or not? The FDA wanted us to do this well-designed, prospective, placebo and active controlled study to characterize and try to answer that question. And as I mentioned, the results were that varenicline did not show a statistically significant increase in neuropsychiatric adverse events in either patients with or without an underlying psychiatric disorder. Well, the results are the first time that anyone has done a direct head-to-head comparison of all 3 currently approved FDA medications for smoking cessation. That is varenicline, bupropion, and nicotine. Those are the 3 currently available medications. And there has not been a placebo-controlled direct head-to-head study of these 3 medications, particularly in patients with a psychiatric disorder. Also, what we found out from this study that is new is that in looking at the neuropsychiatric safety, we used a composite endpoint of 16 events that reflected the real-world type of events that had been reported and that led to this box warning. So what we have now is a well-designed, large study that included patients with and without a psychiatric disorder to help answer this question of whether these events that had been reported, are they related to the drug or are they related to another confounder? And the results of the study showed that there was no significant increase in these neuropsychiatric adverse events in varenicline-treated patients versus placebo. With regards to patients with mental illness, this is a patient population that is currently underserved. They smoke at more than double the rate of the general population. They have a higher rate of smoking-related health diseases, and they typically die up to 25 years earlier than the general population. So they are suffering from the consequences of smoking because they're not being treated aggressively. And there are lots of reasons for that. Mental health professionals should be aware that while it's important to treat their underlying mental illness, it's also important to address the smoking, because that ultimately is what is hurting and killing these people. What this study does show is that all three active drugs did show efficacy in the patients that have an underlying psychiatric disorder. Varenicline was superior to the bupropion and nicotine patch, but all three showed efficacy. So it's really important for the mental health providers to understand that while treating their mental illness is important, they must also focus on the fact that these people do smoke at a higher rate, and are suffering the consequences of smoking-related disease. Well, the good news in the U.S. is that the smoking rate is coming down, and that's a result of a lot of different activities. There's policies in place with no advertising of cigarettes, keeping cigarettes away from people under the age of 18, smoke-free areas, et cetera. These are all important policy activities that are helping to reduce smoking. But people that want to try to quit smoking, many of them have difficulty quitting on their own. And so having treatment options, such as varenicline, bupropion, and nicotine patch, having those treatment options available to them is important, and is important in terms of helping them quit. Because if there's, for example, smoke-free areas, you can create all kinds of policies to discourage people from smoking, but remember that many of them are actually addicted to the nicotine. And while they've tried to quit smoking, they've had great difficulty. So having the options of pharmacologic treatment available to them is an important aspect in terms of helping the general population quit smoking.